Okay, and I'm going to share my screen.
Okay, so
So our freezer, this whole last week.
Like,
they've been giving that to me.
I was like, holy crap.
Okay, if you are having conversations in your office, can you please mute yourself?
Or you can just pull it in.
You what? Oh, sorry, Dale. Okay, welcome everybody to the second fiscal year advocates meeting, but the first of the new year 2023. How is that even possible? Can't believe it, but here we are. Okay, I have the agenda on my screen. Can everyone see it? Do I need to make it a little bigger? Okay, Maurice, I'm going to just turn the time over to you.
Are you going to display that chart I just sent you?
Yes, I was just making sure I was opening the right one.
It's the one that should go to November or December of 22.
Yeah, here we go.
You got it. All right. Well, it's been a rough new year so far, apparently. Had some issues connecting, so I do apologize for that. There's really not a whole lot of changes that are needed to report when it comes to our caseloads. We have had a steady maintenance, I guess, of our cases that we keep monitoring for all of these programs. So food stamps has continued on the slight downturn. Everything else is maintaining the levels previously. If you look back to the November of last year and compare, numbers for all of our programs, the swings that you'll notice, perhaps with the exception of childcare, are roughly within 10%. So it's been a pretty much steady year. One thing I should potentially share with this group is that there have been some changes in terms of our availability of data. These numbers used to come from the Kaiser report that was generated by DHHS. They have discontinued that report, so I have transitioned from using that report into using an EREP report. The only difference that really creates is some of these numbers that I have been using since August of 22. I cannot exactly recreate those because this is a live report and it continues changing, while the Kaiser was a static report that I could refer to. So that is the only difference. But when it comes to swings in workload, they are minimal in terms of these programs. The story really should be told when it comes to the Medicaid programs. I have in the past forwarded a report that this is the other attachment in the first email that kind of talks about those. You'll continue seeing the growth, and this is a different format that it has been in the past as well. I don't know, Gina, it's showing that, there we go. It's showing a blank screen, but you can actually see from the PHE starting that we have, and from the launch of adult expansion, we have had quite a few swings that I believe are, dependent on one another. For example, the CHIP caseload change also kind of corresponds with the PHE stuff. And we have seen some extraordinary growth over the last couple of years, and that's reflected on the majority of our programs. When it comes for Medicaid, the rest of the programs remain pretty steady, and those numbers have not changed that dramatically.
I am sort of mystified that some of these programs, like SNAP, for example, when you talk to pantry folks and everything, you just, in some cases, doubling the number of people, and the demand from their community has just continued to increase. And I'm just surprised that the SNAP caseload is so flat. I'm sure that some of the increase in demand in pantry usage is for folks who probably aren't eligible for SNAP. But even still, you would think that, everyone talking about inflation and the price of food, that we would see some sort of growth in SNAP. And I'm just so shocked that it has remained flat.
And Gina, this is one concern that we've kind of had ourselves, and we were mystified by the same fact as well. I think we do have a theory of why we have not seen that many changes in our SNAP household. I believe it's related to the fact that even though the inflation has really prompted people to be more strapped for food benefits, and everything is costing more, unfortunately, our limits or financial limits have not changed, or income limits have not changed over the past several years. So even though people have experienced inflation, in some of those cases, their incomes have grown and the need for food has grown too. However, the limits that the program has in terms of eligibility have not changed over the course of the last several years. I believe that's what's causing our growth of SNAP cases to not be at the anticipated level.
Yeah, it's just, it's interesting. I mean, and I haven't really heard nationally that there's been a crazy increase or even from other states, but yeah, I guess it's time to talk about increasing our income eligibility limits. So I welcome that conversation. I would suggest up to 185% of poverty, just, as a starting place. So do you all have any questions for Muris about these numbers? And also, go ahead. Sorry.
Just quick question. Have you seen any increase or any changes on the childcare subsidy since all these new changes happen with eligibility and helping the mixed status families being eligible to this?
Yeah, I believe if you look at the numbers, let's go back to November of 2021, and that number is 22,000 cases that we've had for childcare. The number today is 26. And in terms of all the programs that are monitored on this spreadsheet, that's the one that has grown the most. I believe there are various elements to that. One being the year-long eligibility periods and perhaps all the changes to the subsidy programs. I don't know if Rebecca can comment on that, but the numbers are clear. In terms of growth or year over year, that's the program that has probably grown the most when it comes to anything outside of Medicaid.
Yeah, and I would think our significant policy change with the child care subsidy was in March. That policy came in effective, and we did see a jump in cases in the last half of the year. And then also, that's probably, there's been other policy changes that have been made, but that's probably the one that is most significant. And you can see that there has been a small increase.
Can you, this is Gonzalo, can you actually deaggregate that just so we can see the subsidy for mixed status families somehow?
So I think that's a difficult thing to do because we don't ask any information that would identify someone as a mixed status family. And so we can't get a definite number. I do know that we can pull some information about citizenship status if someone has another type of case open, that we could probably get some information for you, but I don't think it's going to get the exact number that you're looking for, but we can get close.
And certainly we cannot do that today. However, we have had this question come up before, and we have done some work in Europe to be able to identify some of these mixed status families. If there is a need by the advocacy groups, I'm willing to engage in the conversation with Rebecca to provide some sort of a report that will perhaps help you with establishing how big that population is. I cannot promise that we can get to there very quickly, but I believe there's information in Europe that can help us. If we get a little bit creative, we can come up with a report.
Absolutely. I mean, I'd be formally at this point requesting that, because this would elaborate on the success of our advocacy efforts for over the past 5 years.
If I recall correctly,
very specifically having to do with subsidy benefits for mixed status families. And I really want to see the success that the changes have created, and I can't see that right now.
Yeah, if I recall correctly, Rebecca, I think I have attempted to provide an EREP report previously. Maybe that'll suffice for this request as well. Maybe we start there, but if you need more from me, I'll do my best to help you out.
Thank you.
I can share that with you. And again, that we can pull that information if they're attached to other programs. If it's a childcare only case, we may not be able to identify that. So we can share what we have.
How can you demonstrate the success of the childcare subsidy changes that we did? Well, I mean, we enabled the legislative and all the changes that happen so that mixed status families can actually apply and benefit from subsidies. How can you demonstrate that that has been successful?
You know, I think the challenge is because we changed those policies so we don't ask that type of information, the citizenship information of the parent. So because we don't ask it, unless we don't obtain that unless it's from another program or we learn that information. And so I don't know if we can give you the exact, I think we can show that there has been an increase, and we can
Yeah, I would really
suggest that
appreciate
it comes
it.
from that policy change, but I don't know if we can quantify each of the cases to that.
Yeah, I mean, we need to know how successful our efforts have been and whether these families are in fact benefiting from it. And you need to give us that information because you're the only ones processing it.
Okay, I'll pull the information that we have available.
Okay, thank you.
Great, thank you. Any other questions about data before we move on? Okay, so Nicole, you are up.
Good morning, everyone. So I just wanted to take a quick minute to share an update about something that we have going on with TANF over the first of this year. So back in March of 2022, the Consolidated Appropriations Act of 2022 was passed. And as part of that act, there was a new requirement for state TANF agencies around providing information to victims of sexual harassment, survivors of domestic violence, sexual assault, or stalking, as well as ensuring that we provide training to staff. So to be compliant with those requirements, we are going to be providing training for both our eligibility division staff as well as our workforce development division staff around those areas and how to recognize that, educate them on how to more effectively interact with customers that might be disclosing that information, kind of walk through some scenarios with that. So we are going to be providing training over the next couple of months, as well as ensuring that we're connecting folks that do disclose that they are experiencing those scenarios, that they are getting connected to resources and assistance through various organizations that some of you all might be involved with. So we're putting together some resources with that we'll have available on our website that we connect folks to. But we might also, we kind of just wanted to give a heads up that if you're in a local area providing services in this arena, your local employment center staff might be reaching out to kind of better connect with you on this so that they can ensure that they're able to get folks connected to you and are aware of the resources and services that you're providing. We've already been in conversations with the Utah Domestic Violence Coalition around this, but just kind of wanted to give you all a heads up about that and let you know that we're providing this training to our staff and kind of working to ensure that we're connecting anyone that does disclose that they're dealing with any of those scenarios I mentioned, that they're getting connected to the resources and assistance that can best help them with their situation. So just kind of wanted to let you all know about that. Any questions?
Great, yeah, any questions for Nicole?
Thanks.
Okay, great, thank you, Nicole. Let's talk about the omnibus bill that passed. Was that just last week or the week before? I can't remember. Anyway, lots of changes coming up, some good things in the omnibus bill in terms of, at least for nutrition, there are some good things. But I will turn the time over to Dale to talk about some of those changes and plans to move forward on those.
I think Kevin Burt's gonna cover that.
Oh,
Yes.
okay, great, thank you.
Dale, why don't you go ahead if you could talk about the EBT program. I was only going to talk about some of the other things.
Oh, Dale, you are muted.
What specifically did you want me to cover, the summer EBT? Kevin?
Yeah, I think they'd certainly be interested in that the summer EBT is going to continue and separate from PEBT. So yeah, if you could talk about that, that'd be great.
Okay. So as Kevin alluded to, summer EBT will become a permanent program starting in 2024. Wait, sorry, I wasn't prepared for this. Yeah, beginning in summer 2024. So that means that anybody that's enrolled in school, and I believe probably children under 6, who are eligible for free and reduced meals and or are on SNAP, will be eligible for a lump sum payment per child to cover some of the summer months, and we currently work with the Utah State Board of Education to identify those students, and we've been working with them the past several years to issue pandemic EBT, and with the Omnibus bill, pandemic EBT will be available this year for summer, but starting in 2024, it will be a permanent program and it'll just be called summer EBT.
But the payments are going down, right? There was, I think that it's about half as much money that was available last year.
It's $40 per month per child, so $150.
Yeah. Okay, yeah, and I think it was 300 and something this last year.
But students are still eligible to go to meal sites as well.
Right, right. Have you heard or have you talked to State Board of Education about how summer EBT might impact the district's willingness to do summer food? I guess that's a question for them.
Yeah. Are you talking about like the summer feeding program?
Yeah. I'm making a note to myself to follow up with USBE about that, because that would be, you'd think that in areas of the state where there might be like some question as to whether they should do a summer program, it's like, oh, well, families can get summer EBT. I wonder what influence that will have on districts that maybe are sort of borderline willing to do the summer food program, because I mean, they're huge, especially in rural communities. There's just, they run really short programs, usually in line with when they do summer school. And so, yeah, this will be interesting to see, one, what gaps this creates and what gaps it fills.
Yeah, we had a meeting with them this morning and they mentioned specifically that the benefits were going down, but they would still be able to access the sites. So
right.
I don't know if that's just for this summer or going forward. So that's something you'd have to follow up with Kathleen.
Yeah, I will shoot her an email. Thank you.
Any questions on the summer EBT?
Okay, let's talk about SNAP emergency. Oh, wait, I have something in the chat, but oh, no. Okay, so let's talk about SNAP and emergency allotments.
So I can talk about that one. DWS is going to be doing a press release in the next 10 minutes. And because we do want to get ahead of that one, as Gina mentioned, the Omnibus bill passed, and early in the pandemic, with the public health emergency, there was some flexibility given to states to issue what was called an emergency issuance for SNAP benefits. And essentially what it did is it doesn't change the eligibility to be eligibility criteria for SNAP, but it increased the amount an individual could receive. And so DWS, the way DWS administers it today is we take all applications or recertifications for the SNAP benefit and we determine the amount you are eligible for, given the rules. And then we issue that at the first part of the month. And then at the end of the month, given with emergency issuance, we issue an emergency payment up to the max allotment per household. And everyone at least gets $95 in emergency benefits. On average, the households that were receiving the emergency issuance was about $175 to $200 per month. And so with the Omnibus, and I think that some of the wording is, hey, we're going to discontinue the emergency issuance, and we're going to take some of that money and use it to fund the summer EBT program. And so within the Omnibus legislation, it provides a hard date and it delinked it from the public health emergency. So there was always this, hey, as long as there's a public health emergency at a national level, and as long as there's a public health order at a state level, you can continue to apply for and issue this emergency issuance month to month to month. The Omnibus puts a clear end date to emergency issuance of February. And so what that means is next month, we will determine eligibility, and individuals who are SNAP eligible, the 74,000-ish people that are families that are eligible, will receive their first payment early in the month of their eligibility, what they're eligible for, the end of February, which what we do is we do it the last Saturday of the month, and then it's available the next Sunday. They will, in February, still get their emergency issuance, okay? March, they will get their early in the month eligibility criteria, but then the end of March, they will not receive an emergency issuance. The last emergency issuance will be the last part of February, and then March, it turns to pre-pandemic levels, given some increases with COLAs and benefits amount that were prior to 2019.
So
It's a big, sorry, go ahead, Gina.
I was going to just say, so you said you're issuing a press release in 10 minutes. What else will you be doing to educate SNAP recipients about this? And, you know, I mean, certainly advocacy, I mean, organizations should start letting folks know.
Correct. And that's why well, you invited me for other things as well, Gina. It just happened that
yes.
the
Yeah.
Omnibus is here as well. But we have a pretty extensive communication plan. We always knew that this benefit was going to be temporary. The public health emergency was set to expire multiple times and kept getting extended. We were notified that we'd have a 60-day notification. And so we never wanted to get too fast in communication that the benefits were going away, because in the end, we thought they might have been going away in the middle of last year, but the public health emergency kept getting extended. So we didn't want to get ahead of the messaging. But now we know that this program ceases. And so I think our first step is the public health, the press release. And then we're going to be available for media for this afternoon, trying to get as much media attention to it as possible. We've also notified all legislators that this program is ending. And one of the reasons we did that is one of the things, and this is kind of a later agenda item, but I'll talk about it now as well. One of the things DWS asked for in our budget is additional funds to be able to fund the Emergency Food Network, which is a support for food pantries and food banks. DWS has a certain amount of money that we receive every single year. The pantries and food banks apply for that assistance, and that we always get more requests than we are able to fund. And we know that with the loss, this $175 to $200 per household per month for the 74,000 families, that's going to drive up what sorry, I joined late, Gina, but it sounded like you were discussing that the demand has increased on the pantries, and this will only increase it further. And so we have asked for that additional funds to be able to meet all of the demands. that we typically receive to be able to fund those food banks and food pantries with the Emergency Food Network. We did ask for it for a one-time 800,000. And the way that it's calculated, we get about 1.2 million. Typically, we get 1.6. We have 1.2 million in funds to allocate. We typically get about 1.6 million in requests. So with inflation and with the SNAP decrease, we asked for an additional 800,000 to get to that 2 million for this year. And hopefully we'll not only be able to meet the demand, but maybe we'll see more requests and be able to distribute more funds through the Emergency Food Network.
Yes, because that funding only goes to, I mean, there are Utah Food Bank, obviously they're serving folks across the state, but and other of the people who get emergency food money have multiple pantries, but it's only 23 organizations. And so we could use a lot more money, serve a lot more folks in communities across the state. Clint, you have a question?
Just more of a follow-up comment to also say, in those requests, they're already told agencies who are getting it, or those 23 agencies, they're already being really conservative with their asks because they've already been told that there's more asks than money available. So I can probably say that need is actually more than what people are even asking for in the application. So I just wanted to say thank you for your efforts.
Yeah, of course. Clint, can I ask you, when you say they're being asked to be conservative in their requests, who's asking them that to do that?
So I think when they have the RFP meeting about like how to apply and things.
Okay.
And then again, I think they're trying to be transparent and let people know that there's only limited resources. And so I think people who are submitting their applications are already thinking in mind that there's not going to be enough for their asks. So people are already kind of holding back on their applications, just knowing that there's limited resources. But when you go out to a food pantry, like I'm thinking in Price or something, right? Like they will tell you, oh, I would have definitely asked for more, but we know that there's not an infinite amount of resources.
Well, I think that's true for some folks, Clint. I mean, there were 610,000 more in funding requests than was available. So, and there were no new applications. That was, in fact, they're funding one fewer agencies this year than they did in fiscal year 2022. So I think some pantries might be being conservative in their ask, but I know others are not.
Well, and that's what I would probably say, Clint. I don't think, I don't want the top to come off of it and say, just ask for whatever you want. But I do think it's good that they ask for what they need. I think one of the strong arguments to make when you're seeking legislative funding is to show that the demand is greater than the current allocation. And I think that's one of our strong, because a lot of times it's like, well, we gave you 1.2 million and that's what the need is, right? If we're able to show that the need is significantly greater, I think it doesn't guarantee by any means that we'll get funding legislatively, but I do think it provides a strong argument that we are consistently 600,000 plus lower than the amount. And so I think it's great that people be reasonable with their requests, but I also don't think they should hold back and not ask for what they need. I think they shouldn't inflate it, but they shouldn't cap it either. They should be asking for what they need, and then we'll distribute what's available. But I think sometimes it does provide a good argument for the state agencies to say, hey, the need is greater than what is currently available.
Well, I'm just glad that we're past. I'm glad that we're past having it recommended for elimination. I think that feels like progress. Yes. I do have another question about that, specifically about that funding, not the omnibus, but in the governor's budget, it says that it's one-time funding, but it's requesting it from FEMA reimbursement. Can you maybe talk about that a little bit so that it wouldn't be coming from the general fund?
I cannot talk about that. I don't know that.
Oh, okay. Okay.
So sorry, Gina, I'll have to do some research on that.
No, I'll find that part in the governor's budget and shoot it over to you.
Yeah, and I think, and yeah, I'm not sure what the FEMA is. So essentially what the governor does is they get all of these requests and they take a look at what funding sources are available. And if you can get it from resources that are not general fund, a lot of times that does often help with the request. And then you're able to apply the general fund to somewhere else. And so you've seen that with ARPA funds. We've done that quite a bit with ARPA funds. I'll talk a little bit more about the deeply affordable housing later. That is pretty heavy ARPA funds. So you basically look at these off-branched resources and what is allowable. And if you can get something that's not general fund to pay for it, typically they'll always go for those first. And then again, it frees up general fund to be able to pay for things that only general fund can pay for. We see that a lot with the Department of Workforce Services with our TANF funds. The TANF funds are often looked at, hey, can TANF pay for this so that we don't have to use general fund to pay for it? So it's kind of the same mechanism, would be my guess, Gina, but I haven't looked into the specifics of that.
Okay, I'll find that section in the governor's budget and send it over to you, what page it's on. So, because
yeah,
I mean,
it does say one-time state and local fiscal recovery fund reallocation. So I'm not super familiar with that fund, but yeah, I think they're just trying to say, hey, here's a fund over here. Let's pull from that.
Well,
and
yeah,
hope to get it approved.
I mean,
more likely to be approved.
Yeah, and going into those conversations with legislators, and I know that Senator Escamilla is also going to do a funding request, an appropriations request, and it just would, I mean, it would be helpful, I think, for us to know what that is, so that as we develop those conversations and those strategies, that if it isn't coming from the general fund, that is a really good thing.
Yeah.
If there's another funding mechanism that we can use.
Yeah, and other funding resources often have demand on them as well. Like,
sure.
And so it gets a little bit tricky. So I think in the end, we certainly have, with the loss of the emergency issuance, with the requests outpacing the availability and the demand on pantry and the cost of food, I think all of this lines up to certainly make a strong argument by us getting it in the governor's budget. For those not familiar with state agencies process, by putting it in the governor's budget, we can advocate for it. If it's not in the governor's budget, we are unable to, we become subject matter experts to be able to say, hey, well, this is what we could say. We get 1.2 million, we have 600. But now we can actually say, hey, here's why it's a good idea to fund it, because the governor's budget has included it in the budget. And so the governor's budget is, again, just kind of a outline of what he recommends, and often is not followed legislatively.
Right.
But for state agencies, it's critically important, because if it does make it into the governor's budget, the state agency can actively try to pursue funding for it, because the state agency and the governor's office both agree that it's critical funding and should be pursued and prioritized.
Great. Okay. And then now I have one more follow-up, and this is a omnibus question, but has to do with sort of like the nutrition arena. Is the ending of, so what does the omnibus, or does the omnibus do anything, and Dale, this might be more of a you question, to the reinstatement of the ABOD time limits and college student SNAP eligibility? Are those impacted at all by the omnibus?
I don't see anything in the summary that would indicate
Okay.
that. We have a couple of meetings with FNS, and we're awaiting their guidance on that. but
Okay. Okay.
we haven't received anything yet.
Okay. Great. Thank you.
And just to follow up with Clint, I get what you were saying, Clint, and I certainly didn't mean it to come across of, hey, you got to tell people. In the end, there is value in more demand than available funding. I think that does provide a good argument. So if you do talk to those, just let them know that, hey, it's great to be conservative, but you don't have to be. We will still distribute what's available, but be put what the need is, and we will do our best to meet what we can, given our limitations on what funding is available.
And I
And then
certainly
back-
don't think anyone's asking for more than they need.
Yeah, and just to backtrack a little bit, we are going to be deploying, or we're going to send a notice to every single SNAP recipient in February to let them know that the funding is no longer going to be available. We are putting it on our IVR, which is our phone messaging. So anybody that calls in will get messaging before they get put into the queue. We are going to put it on our website, our My Case website. So anytime anybody logs in to complete, to report a change or to look at their benefits or things like that, they'll get notification. It's going to be difficult. This benefit has been available to individuals for a long period of time. And I think when that happens, a lot of people adjust their budget accordingly. And so I think this is going to be difficult. I know that a lot of discussion has been about Medicaid and the unwinding of Medicaid, which I also think will be difficult, but this certainly has an immediate impact because 1 month they have it, everybody has it, and the next month nobody has it. And so keep in mind though, that SNAP is not going away. People will still receive SNAP. It's just that it'll be at their eligibility level without that emergency issuance.
Can I just add, Kevin, that we anticipate getting approval for February, but we still need to apply for it.
Correct. And so I met with the Department of Health and Human Services. In order to receive February, you have to apply for it and be approved, but there also has to still be a public health order at a state level. The Department of Health and Human Services is the one that keeps that active. And I've explained to them that, hey, we need it active for the month of February to be able to apply for this. And per them, I don't think there's any discussion of ending it, given the omnibus, to be able to continue to get that last month of emergency issuance.
Which
But we do have to apply for it and get approved, as Dale said.
But I do think that the public health emergency has to go away in order to end the ABOD time limit, or the ABOD, the ABOD time limit and the college student eligibility.
Oh, okay.
So, yeah.
If that's the case, one of the things that this did do is Medicaid, it de-linked these programs from the public health emergency. And so Medicaid unwinding is no longer attached to the public health emergency existing, and SNAP emergency issuance is also no longer attached to it. It just gave hard deadlines
Right.
if these programs stop this date and this date. And I think the reason for that is to continue the public health emergency for other things needed, but to start to unwind the SNAP emergency issuance and Medicaid continuous coverage.
Yeah, so I'll be interested, Dale. I'll shoot you an email, or we can talk about your meetings with FNS and what you find out around the guidance that they're giving states.
Sounds good.
Thank you. Anything else you want to talk about with the omnibus and then state legislative session, Kevin?
Well, I do want to talk about one more thing with the press release, because the press release is going to have another component to it.
Okay, great, thanks.
Okay. And that is about emergency rental assistance. So emergency rental assistance, we as a state received a amount of funds to be able to help individuals who pay their rent during the pandemic. It was fully federally funded, but it was limited in how much funds were available. We have stood that program up. Let me get this. The program launched March 15th, 2021. And as of the end of December, so as of the end of the last few weeks, we've processed over 97,000 applications and paid out about $287 million to eligible Utahns. Unfortunately, and this is the press release, the funds are near exhaustion. And so we are announcing today that we will be closing down the portal to apply for emergency rental assistance at the end of February 5th, 2023, so in a month. So individuals can continue to apply up through February 5th. It'll close the night 11:59 of February 5th. And keep in mind, if a person applies in February, let me make sure I get this one right too. If a person applies in February, they not only apply for February, but in many instances, they apply for the months following it as well. And that will continue to be the case for applications received in February. Here it is. Applications submitted by the date. Applications with a termed lease may receive 4 months of rental assistance. And so we will keep the portal open through February 5th. All applications turned in, we will process, and we will process them in first come, first serve. So that the things that are eligible, everything's provided and are determined eligible will be processed, and we'll continue to process them until the funds are exhausted or until all applications are processed. And then any leftover funds from emergency rental assistance, the small amount that would be left, can be used for other housing projects. But we do not intend to reopen the portal after February 5th for emergency rentals.
Kevin, do you know approximately how much funding is currently available that needs to be exhausted?
About $30 million. And on average per month, we issue about $14 to $15 million a month in benefits. And so that's why we believe it will be exhausted with that February 5th. We also believe with this kind of communication, we'll probably get a high application volume because we're announcing that the program is ending. So there'll be probably an increase in applications. Doesn't necessarily mean an increase in eligible applications, just an increase in applications. But what we want to do is make sure to process those. Now, there are individuals who have been approved and they were going to, their 4th month is going to be June, or well, their 4th month is going to be April. There is no reapplication. So it simply stops. The funding is expired. And so we're going to be communicating with individuals who are receiving the rental assistance to let them know that there is no recertification beyond this. So it's not simply that February 5th, the application is, the funding is exhausted and spent. And so the emergency rental assistance program will just discontinue.
Okay. Yeah, well, it's gonna be a rough year, man.
Yeah.
Okay.
We're doing our best to kind of put the messaging out there. These are both federally funded programs. They're not a state decision to end. I think that our Housing Community Development Division did an excellent job distributing these funds. I think there was a lot of emergency rental assistance programs that were fraudulent across the nation. And unfortunately, when you issue it to fraud, that gets spent and it's not available to people who are eligible. And so I think I see Jennifer Edwards on the meeting. Her and her team did an excellent job to make sure that it was processed timely and make sure that it was processed to those eligible. And so actually in Utah, in some ways it lasted longer than it did in other states because they pushed out as many as possible. And I think they saw large amounts of fraud, similar to what other states saw with unemployment insurance fraud. So that is the press release that is going out or went out at 10:30, I assume. So, and then again, hopefully we'll get some media on it and communicate that out to as much impacted people as possible, because we think both of those programs certainly have a significant impact to individuals.
Yes, indeed. Okay, any other? I know that there were some positive things that happened with WIC, and I know that Rick and Chris are on the line.
Yeah.
Chris, do you want to talk about the good changes in WIC?
Yep.
Or bad changes in WIC too?
Yeah. Yeah, I can just run down the list that I have, if that's all right.
Yeah.
First, Happy New Year, everybody. It's good to see you. In WIC, there's changes going on, of course, like for all of us, and some are good. I wanted to start off with infant formula, and I'm actually going to read a statement that I received from our vendor manager this morning, as she has the best pulse on what's going on with infant formula. So forgive me as I read this, but I think it'll be helpful for you. And I can send this over to Gina if it should be included in meeting minutes, etc. But basically, the general Utah report would be that it has been 11 months since Abbott Nutrition or Abbott Laboratories issued the massive infant formula recall. While Utah is not back up to our pre-recall inventory, grocery stores across the state currently have most types of infant formula available for consumers. Supply of both the standard milk-based and special formulas for babies with digestion or metabolic challenges increases each week and becomes more accessible to families, which is great. Many retailers elected to bring in foreign imported formulas during the recall and continue to stock them in their stores. Online and wholesale retailers remain a viable resource for Utah consumers. And the WIC specific update is that the current contract formula for Utah WIC is our Similac brand. That is through Abbott. The contract formulas are in healthy supply across the state and currently available at almost all WIC authorized grocery stores. WIC continues to work with clients and pediatricians to ensure access to needed formulas, and the Utah WIC anticipates an easy transition back to standard practices for formula issuance over the next 3 months. We are optimistic that overall formula inventory will continue to increase and resume to normal levels over the next 6 months. That's the end of that prepared statement. However, to go along with that, one of the things that went out to 5,414 physicians, healthcare providers, mid-level providers, just a few days ago was a letter suggesting that, or not suggesting, but informing them that the availability or to select pretty much any formulas that would be on the shelf for WIC participants is going away. The waivers from USDA are ending January 31st. And so as of January 1st, 5 days ago, we are no longer going to be just offering all formulas under our umbrella package that kind of allows anything on the shelf. If they are not issued contract formulas, the Similac products, then participants will need to seek out a prescription through the food and formula authorization form the physicians used previously before this inventory issue and recall came out 11 months ago. So please know that that is going away and that participants will be required to seek out a prescription. Questions on that? Okay, moving on, we have submitted our project documentation. Some of you are aware that we are attempting to transition away from smart card EBT to online EBT, similar to the SNAP program and many other WIC programs across the country. All of the smart card EBT programs across the country in WIC, I understand there's about 13 of us. Our host processor, Solutran, was sold to Optum Healthcare, a subsidiary of United Healthcare, and they are no longer accepting new work in the smart card world, forcing a change of all of us from smart card technology to online technology. Our eventual goal, of course, is to go to mobile WIC on our phones for participants, which will be a great upgrade, but that won't be immediately available. It'll be over time. So please know that we've written all of our documents. Our RFP is written and all submitted to USDA for approval. And hopefully by springtime, March, hopefully we will be able to go out to market with the RFP, hire a new post processor to then help us transition to online EBT. Next is our WIC caseload. It's been a good year for us. And between October 21 and December 22, we increased our caseload at 8.88% across the state. We started October with 36,545 participants and ended in December with 39,793 participants. So we're really pleased with that. One of the reasons that I personally believe that our participation went up was through the increase in fresh fruits and vegetables that has been available to us. Of course, also our I think as Dale was speaking earlier, or maybe it was Kevin, I'm not sure, the income levels have not changed necessarily for some of the programs that they described, but our income levels have gone up. Family of four can qualify in WIC at $51,338, which helps a lot of families. So that might be another reason that our participation is going up. But going back to the cash value vouchers for fruits and vegetables, through the omnibus bill in WIC, good news for us is that children will be able to receive $25 throughout the remainder of the year, and the pregnant and postpartum women would be at a level of $44, and all breastfeeding mothers would be at $49. So it's a really great benefit over what it was. And I think the original amounts were, I think, $9 and $11 or $9 and $12, but quite a significant increase. So we're very happy to be able to provide that. When you think about it, if you've got those amounts for each person in your household and the 3 or 4 people on WIC, that's a lot of veg and fruit to consume. But we're seeing that the dollars being spent to many hundreds of thousands of dollars each month on fresh fruits and vegetables, and it's a really a good thing for families, and of course, a good thing for farmers. That is the update that I had. I don't know if there's any questions for myself or Rick. Okay, thank you.
Great, thank you, Chris. Thanks for being here.
You're welcome.
Okay, then Kevin, back to you to wrap up your info.
Yeah, thanks, Gina. I wanted to review some of the budget items I thought this group would be interested in and answer any questions that you might have about those. A couple things when it relates to the Medicaid program that made it into the governor's budget that is associated with the Department of Workforce Services and the Department of Health and Human Services is family planning services increasing to a coverage to cover individuals who are 250% or below the federal poverty level. That includes contraceptive screening, counseling, and so there is funding for that to be able to program that in the EREP system and then offer it to individuals who apply for it. Again, keep in mind, these are just budget requests. They haven't been approved. They're simply budget requests that will be discussed during the general session. Another thing that did make it through is the Medicaid for 12 months for postpartum. Currently it's 60 days. And that currently has a request in the governor's budget to increase it from 60 days for postpartum Medicaid coverage to the 12 months of postpartum coverage. And so those are some of the DWS ones that are applicable to this group. Remember, we asked for the Emergency Food Network, Family Planning Services, Medicaid for 12-month postpartum. The other ones are pretty heavily related to housing and homeless services. I do want to kind of explain the process because I do think this really does help with a lot of the requests and organized requests. So historically, there are a lot of efforts to address housing, affordable housing or homeless services, but it's been very difficult to organize the strategies and unify in strategies. And so one thing that changed this year for the first time is we introduced, or the legislative body introduced, the Unified Economic Opportunity Commission. And so the Unified Economic Opportunity Commission is chaired or includes the governor, the Speaker of the House, and the Senate President. And it meets, I think it's 3 times a year, and will continue again next year. And then there are subcommittees that address specific issues. One of those subcommittees that is supported by the Department of Workforce Services is the Commission on Housing Affordability, which is currently chaired by Senator Lincoln Fillmore and Representative Stephen White. And so the Commission on Housing Affordability addresses housing and homeless and prioritize what they see as critical functions, and then prioritizes those, brings those to the Unified Economic Opportunity Commission, and then the Unified Economic Opportunity Commission supports and prioritizes all the various subcommittees. The value in doing this is now we have legislative engagement on the grassroots level about these requests, so they're familiar with them, and we have the governor, the chair, or the speaker, and the Senate or the president all familiar with them as well. when the Unified Economic Opportunity Commission supports something, it means they support the concept. It doesn't necessarily mean they support the funding requested. And so many of the housing things that and homeless service funds that we have asked for that are in the governor's budget followed this process. And that really does help because it makes, again, everyone heavily involved and agree with the process. And then it's just a matter of, well, are they going to get approved and for what funding level? And so a couple things for the housing that got approved through the Unified or supported through the Unified Economic Opportunity Commission was Oling Walker Housing for trust fund gap financing, 5 million one time, 10 million ongoing. First time home buyer, we did that for individuals who are police officers, first time home. This, we got 11 million one time, or we're requesting 11 million one time for educator and firefighter first time home buyers. So it's a loan to help individuals who are in those work industries buy their first home. Critical, and then rural housing, which provides a no interest loan for individuals that are constructing homes in rural Utah, 2.75 million ongoing. As far as affordable housing, there was one more that was included, and it's critical home repair. Critical home repair is a program that is used by the Habitat for Humanity. And it basically, it's a fund to help individuals who are residing in unsafe homes to get repairs to fix those homes and make them safe. They got 2 million invested, and they helped 573 people with that 2 million. 207 of them are children, 85 are disabled, 92 are seniors. And the critical home repair asked for 1 million ongoing to expand those efforts. So that was included in the governor's budget as well. And then finally, before we jump into any questions that people might have, again, keep in mind the Unified Economic Opportunity Commission did approve deeply affordable housing. Last year, we asked for, I think it was 150 million in deeply affordable housing grants, and we got 55 million. And we sent that out for grant requests. We got 168 million in requests. And so we've asked for more to be able to meet that demand. Some of that is coming from ARPA, 80 million from ARPA, 20 million one time. So we are seeking 100 million for that, again, to meet that increased demand. What that does do is we visited the Point at one of the social services interim committees, and it was a hotel that was converted into a deeply affordable housing unit for individuals who are under 40% AMI. And it not only provides housing, but it provides food, wraparound services. There was counseling, there was substance abuse treatment. And in this particular one, they offered employment in working in the kitchen, the on-site kitchen, and earning wages as well. It was pretty incredible to see. And so this deeply affordable housing would expand that, as well as attainable housing grants, which are 30% or below AMI for long-term deed restrictions. And then resource centers, we did ask for some funds to help with their debt. And then there is some discussion about potential low barrier shelter or sanctioned camping planning services to be able to discuss, does it make sense for Utah to consider low barrier shelter or sanctioned camping planning? And that, in a quick nutshell, is some of the budget requests that are related to DWS.
Any questions for Kevin on legislative items? Well, we are certainly, Utahns Against Hunger is certainly looking forward to the conversation about additional funding for emergency food. And I just got a call from Fox 13. So they are responding, Kevin, to your press release. So
yeah.
Kevin, this is Karen McCandless down at Community Action Services and Food Bank in Provo. Just wondering if the press release is going to be in Spanish as well.
That is a good question. I know that we will have, for media availability, we will have a Spanish speaker there. I thought we were, but I will follow up with that. It is a great question.
Okay.
I think sometimes we think about it, but then we don't cover everything. So I will follow up to make sure that it is available in Spanish as well.
Great. Thank you so much.
You got it.
Great. Any other questions for Kevin? Okay, well, that brings us to the end of our agenda. Our next advocates meeting will be on Thursday, April 6th, after about a month after the state legislative session is over. So we'll have plenty, I'm sure, to talk about. Any other parting questions before I let you all go? Okay, great. So I will follow up with the recording, both the video and the audio. And then is Gonzalo still on the call? So I'll follow up with Maurice and with Rebecca about that report that Gonzalo asked about. So other than that, I will get something out to you probably by the end of this week, although it's already Thursday, so tomorrow. Enjoy the rest of your week, and we'll see some of you in a couple of weeks at the legislative session. So be well and talk to you soon. Bye-bye.
Thanks, Gina.